it's very important to have received all the doses that are recommended, and also to take measures to stay safe and to protect people around you as well. So right now, our layers of protection are similar, slightly different. We're in a better place. We were able to lift the restrictions we had put in place before, which is good. We're coming back together safely. But we need to continue. And so I want to emphasize, and this is very important, that individually, we all continue to play a role. You know, I see people here wearing masks, keeping your distances when you're in crowds, not going out when you're sick. These kinds of things are extremely important. Washing your hands as well, very important. And so these things are measures, actions that people can take, continue to take, and people do, and we encourage that. We should continue to respect everyone's personal space. Some people have various medical conditions that put them at higher risk. It's important to respect that. Consider their particular situation before interacting with them. And I mentioned clean your hands and staying home when you're sick. That is very important. When you know you're sick, you don't want to bring the virus to others. Most importantly, of course, and it's critical, is to get vaccinated. And we have made many recommendations for the primary series, the booster, for some people a second booster, and now we're going to be talking about the fall booster. Vaccines and vaccination offer excellent protection against severe disease, and that's the path we're on, and we continue. We're taking the next step in the fall. So the National Advisory Committee on Immunization, NACI, is very strongly recommending that vulnerable people, so those 65 years and over, and people with medical conditions, receive a fall booster. NACI also recommends that all others between 12 and 64 receive a fall booster as well. So NACI is a group of experts from various backgrounds and expertise, working together, keeping a very close eye on the situation, on this pandemic, the epidemiology of the pandemic, on the vaccines that are available, keeping an eye on research, and on an ongoing basis, keeping track of all that to make sure that they can make the best recommendations to guide us, particularly with the vaccines, on how to manage this pandemic in the best way possible. So we have in BC followed very closely NACI's advice, and we continue to do so. And so this is no different at this time, and this is what their latest recommendations are about for the fall booster. So I want to talk a little bit more about also new vaccines that are more than likely coming to us. I think this is very important to know at this time, understanding what's coming for us in the fall. So after over a year and a half, maybe a little bit more than that even, we have now direct experience with COVID-19 vaccines around the world. So we've learned a lot. And so now we have a much deeper understanding also on how to make those vaccines to protect us against current strains, current viruses that are circulating. So what's important to know now is that the manufacturers have developed vaccines that will be better adapted to Omicron, which is great news. And this is what we're going to see more than likely. Things seem to go very well right now in terms of their assessment. They seem to be very promising. And the virus has evolved, as you know, over time. We have the original virus that started a while ago now, and then we had the alpha, the beta, the delta, and many others. And it has evolved, and our vaccines need to evolve as well, so that as the virus goes further out, away from the vaccine that we have now, we need to have a vaccine that actually is closer related to what circulates to be more effective. So these bivalent vaccines, and bivalent means two, it's going to contain the same as the ones we have now, the original virus, and the Omicron as well. It'll be able to be effective against those two strains. And they look very promising, like I said, but they still need approval by Health Canada. And so this is underway right now. So we have to wait for that. Like I said, it looks promising, but it's not done until we have confirmation.